Here are 10 alarming signs of stroke a month before. Losing your ability to control your own body is a nightmare no one wants to become a reality. But what if you knew what to look for a month before a stroke occurred? Would you want to know? In this video, we will tell you the top 10 possible warning signs of a stroke 30 days before it happens. Think about being able to see the stroke coming and being able to take action. Seeing these warning signs and seeking medical treatment could make all the difference. Watch until the end because many people miss the last and most important sign. Like this video if you want others to find this information. It could save a life. Remember, this video is for informational and educational purposes only. Speak to your licensed healthcare provider immediately if you have any concerns. Now, let's get into the alarming warning signs to look for. Number 10 is the sudden onset of confusion or trouble understanding. Losing blood flow to certain parts of the brain can affect cognitive function, leading to confusion, difficulty understanding speech or written words, or trouble with memory. Number 9 is trouble with coordination or balance. You may experience sudden dizziness, loss of balance, or coordination problems. Also, you may have trouble walking or have a lack of coordination in your movements. Number 8 is suddenly having difficulty swallowing. Having a stroke can affect the muscles you use in swallowing, leading to difficulty swallowing food or liquids. Depending on the location and extent of the disruption in blood flow to the brain, temporary symptoms can lead to weakness or paralysis of the muscles involved in swallowing. Number 7 is a sudden increase in your heart rate. Depending on the location of the disruption within the brain, it can affect the regulation of your heart rate. For example, if disruption occurs in the brainstem, which is responsible for controlling vital functions like heart rate and breathing, can disrupt the normal regulation of your heart rate. The causes of stroke can also affect the normal functioning of the autonomic nervous system, which regulates various involuntary bodily functions, including heart rate. Damage to certain areas of the brain involved in autonomic control can lead to imbalances in the sympathetic and parasympathetic nervous systems, resulting in fluctuations in your heart rate. This may manifest as an increased heart rate, tachycardia, or an irregular heart rhythm. Number 6 is extreme fatigue. B12 is a vitamin that helps your body with nutrient absorption, which ups your energy, but when it is low, your energy could be low as well. A B12 deficiency can lead to a stroke because it increases your body's production of homocysteine, causing a cascading effect of increased oxidative stress and inflammation in your blood vessels, upping your risk of stroke. This deficiency can happen at any age, but children and pregnant women are the most at risk for this type of deficiency. Number 5 is changes in sensation in your extremities. You could experience episodes of weakness or numbness. You may experience these symptoms, particularly on one side of your body. It could affect your face, arm, or leg. Also, you may experience difficulty smiling or your smile may appear uneven. Number 4 is sudden and severe headaches. You may experience the worst headache of your life. Many describe it as the worst headache they have ever had before a stroke occurs. This headache may be accompanied by dizziness, vomiting, or altered consciousness. Number 3 is high blood pressure. High blood pressure puts increased stress on the walls of your blood vessels, causing them to weaken and become damaged over time. This can lead to the formation of small tears or ruptures in the blood vessel walls. This is called an aneurysm, which is a bulge or ballooning of a blood vessel wall, which can rupture and cause bleeding into the brain, leading to a hemorrhagic stroke. Also, chronic high blood pressure can cause atherosclerosis, a condition characterized by the buildup of fat on the inner walls of the arteries. Over time, this plaque can narrow and harden the arteries, reducing blood flow to the brain. If the blood supply to the brain is significantly reduced or blocked, it can result in a stroke. Number 2 is changes in your vision. You may experience sudden vision changes, such as blurred vision, double vision, or loss of vision in one or both eyes. This can be temporary and lead you to believe you are okay after it apparently resolves. Number 1 is the most important, but because it's temporary, many people may be scared in the moment but dismiss the symptoms once they stop. Number 1 is a combination of any of the previous alarming warning signs but are severe and temporary. You may experience what people may think of as a brain fart. It may last 5 minutes or less. Symptoms could include suddenly being unable to see in one of both eyes, or not being able to speak, or losing control of your body, such as thinking about wanting to walk but your legs aren't moving. These could be telltale signs that you are having a severe but temporary blockage of blood flow to your brain. Sometimes these are called a TIA or transient ischemic stroke, often referred to as a mini stroke. A transient ischemic stroke occurs when there is a temporary disruption of blood flow to a part of the brain, leading to temporary neurological symptoms. The symptoms of a transient ischemic stroke are similar to those of a stroke, but typically last for a shorter duration, usually a few minutes to a few hours, with most resolving within 24 hours. During a TIA, the blood flow to the brain is temporarily interrupted, usually due to a blood clot or a narrowing of blood vessels. The underlying causes of a TIA are often the same as those of strokes, such as atherosclerosis, hardening of the arteries, blood clots, or other vascular conditions. However, in a TIA, the blood flow is restored before any permanent damage occurs, unlike in a stroke where there is lasting damage to brain tissue. Although the symptoms are temporary, they should not be ignored. Having a TIA is often considered as a warning sign of an increased risk of a more severe stroke in the future. Medical evaluation is necessary to identify the underlying cause of the TIA and to implement preventive measures to reduce the risk of a stroke. About 43% of stroke patients will have had a transient ischemic stroke long before their severe stroke that lands them in the hospital. Now that you know these top 10 alarming warning signs of a stroke, share this video with your friends and family so they know how to help you if you experience these symptoms and don't realize it. Because your body is a miraculous and adaptable living structure, it is hard to know exactly if these signs will occur in your case, and there is no scientific evidence that these are surefire precursors to stroke, so please speak to your healthcare provider. So we aren't all doom and gloom on this channel. We are here to give you meaningful health tips. In the case of strokes, prevention is most assuredly the key. Why? Because 80% of strokes are preventable. And what's the biggest risk factor? High blood pressure. So, let's briefly cover natural ways to prevent a stroke from happening. Reducing stress is a great way to protect your body from disease. Take time to enjoy your surroundings and take breaks when you get overwhelmed. Another way is to eat right. A heart-healthy diet, sometimes called the Mediterranean diet, can do wonders for your health. Exercising, even if it's just walking, is great for your body. Get started today, even if it's just 30 minutes a day. And last but not least is getting quality sleep to reset your body. Studies have found a link between insomnia and stroke risk, making practicing good sleeping habits even more important. All these things can help reduce your body's cortisol levels and reduce inflammation, which plays a role in your risk of stroke. Treat your body the way it deserves to be and add some healthy lifestyle changes to your daily routine. Stay healthy and happy, and stop disease before it stops you. Thanks for watching, and subscribe for more health and wellness videos like these.